Hi, my name is Jen. I am a RN in an electrophysiology lab. A lot of times when I get students, they ask me what is going on at the tissue level that's causing the deflections that everybody is seeing on the QRS. And so this is a basic overview of a couple of things that can happen down in the heart and why they look like they do up on the surface paper. Quick review. This is how a normal sinus beat is supposed to look. P wave, QRS, and over here is the T wave. The P wave is the depolarization of the atrium, QRS is the depolarization of the ventricles, and the T wave is the repolarization of the ventricles, getting ready for the next beat. You can't see the repolarization of the P because it is buried in the QRS. One of the first things that you're going to need to know if you're trying to diagnose an EKG is what are the intervals. So knowing the normals is very important. First one is PR. A normal PR is less than 0.2 and greater than 0.12. Second is the QRS. That is going to be less than 0.12. I'm sorry, I wrote that wrong. Less than 0.12, but greater than 0.08. And then another reading that a lot of nurses really care about because medications can affect it quite a bit is the QT interval. The QT interval should be less than 0.4. If it starts getting longer than that, you start worrying about RNT phenomenon, which causes torsades. So, if you're measuring out a normal beat on a surface EKG, this is what a sinus beat is supposed to look like. But what is going on inside the heart that is causing all of this to happen? My simple little heart here. Right atrium, right ventricle. Left atrium, left ventricle. There's two major nodes in the top part of the heart. The SA node, which stands for sinoatrial, and the AV node, which is atrioventricular. The two atria are able to communicate with each other. The two ventricles are able to communicate with each other. The only way that they're supposed to be able to the only way the atrium are supposed to be able to talk to the ventricles, though, is through the AV node. If there's double communication or if there's an extra pathway, it's going to cause an arrhythmia. So, the PR interval is the amount of time that it takes the impulse sent from the SA node up here down to the apex of the heart where the beat starts. The SA node generates the beat. It goes shooting over to the left atrium, and so the two squeeze simultaneously. It also goes down through the AV node and pauses. The AV node has what is called decremental tissue. The point of that is to allow time for the actual mechanics of the heart to catch up with what is going on with the electricity. So the two atria contract, they push a little bit extra blood into the two ventricles, and that is called atrial kick. After it pauses at the AV node, it goes shooting down the bundle branches. There's one down here on the right side, and there's two over on the left. On the left, these guys are called fascicles. So something to know about the bundle branches is that they are actually made out of Purkinje fibers. They are just starting all at once. So it's kind of like, if you're familiar with the anatomy of the spine, it's kind of like the quada equina. It's all isolated and bundled together at the top. As it gets down, it starts to split apart into different fibers. The point of this is that they don't want the electricity to start happening until it actually hits the bottom of the bundle branches. If you remember your anatomy, the aorta comes up towards the top. The pulmonary artery shoots up towards the top. So you want your ventricles to squeeze from the bottom. So what causes the PR interval? This amount of time from the beginning of the P wave to the first deflection in the QRS is the amount of time it takes for the electricity to make its way from the sinoatrial node through the AV node and down here to where the electricity starts to come out of the bundle branches and cause the squeeze. The QRS interval, 0.12 to 0.08, is the amount of time that it takes for the electricity to move from the apex of the heart to capture all of the tissue in the ventricles so that the flow will start at the bottom and go back up to the top. One of the things that's important to know about heart anatomy is that heart cells are extremely specialized. One of the things that's important is that they all have pacemaker ability, which means any cell in your heart could take over from the sinoatrial node and cause an electrical impulse. They can communicate cell to cell. So electrical impulse that starts here, up here at the sinoatrial node, can make it all the way down here to the base of the bundle branches. And the last thing is that they can all, of course, contract. So if you're interested in knowing a little bit more about the blocks, check out the next video.